Still developing tonight, after 7 years leading the state's only university for health and services, Dr. Cam Patterson announced today he will vacate the position of UAMS chancellor. Dr. Patterson has a notable career in cardiology and healthcare administration, where his work once garnered $60 million from various health organizations, including the American Heart Association. Dr. Patterson assumed the title of chancellor in 2018, but notified the THV11 newsroom that he must resign to deal with his own medical needs. Dr. Patterson writes in satisfaction for the work contributed by UAMS throughout his tenure, and says he's, quote, been the luckiest guy to be a part of it. Dr. Patterson will return to regular duties in a faculty position, and upon his resignation, University of Arkansas Assistant President J.B. Silveria will step in as interim. An annual study measuring child well-being in Arkansas is out.
It ranks this state well below the national average yet again. THV11's Maya Ellison shares more from what local advocates say about the report and where they're focused this year.
A whole 365 days have passed. We've had a legislative session. We've had things that we're attempting to implement, and yet our children are still not faring well.
That's Director of Arkansas Advocates for Children and Families, Keisa Smith-Brantley. She and her team works closely with the Annie E. Casey Foundation, which releases the annual Kids Count Data Book, a nationwide study on child well-being.
How are policies being addressed in that respective state, and how well are kids doing, with the hope that states will take that data and look at ways that they can improve.
The study reviews 16 indicators in 4 key areas: economic well-being, education, health, family, and community.
And the purpose of having those metrics is to be able to compare apples to apples in terms of how states are doing.
This year's study showed Arkansas ranked 45th overall, the same as last year. Just take a look at this breakdown: 45th in economic well-being, 47th in health, 46th in family and community, and 36th in education.
That tracks.
It seems like you're not surprised.
No, I mean, we have always struggled with being kind of at the bottom of the list.
Brantley notes several key factors behind Arkansas's rank, like the state's 3rd grade reading level, healthcare disparities, and even child poverty levels among different demographics.
I am a little concerned about the changes that I'm seeing with the state of the educational department here.
Brantley says change starts with stronger policy and resource investment. The governor's office says they're prioritizing just that. In a statement provided to THV11 News in response to the report, the Sanders administration emphasized the success of programs like Arkansas Learns, Healthy Moms, and the Healthy Babies Act.
It is important to look at policies that help Arkansans across the board, get Arkansans into, on a better footing. And that means healthy Arkansans that feel fully supported by their community, that are able to go to work every day.
In Little Rock, Maya Ellison, THV11 News.